Pulse is the number of heartbeats per minute. Pulse gives information about the health of the heart by indicating its pumping speed. An abnormal pulse indicates that the heart is not pumping at the right speed, which is often the first sign of a medical problem. Before you can check the pulse, first you need to find the pulse. To do this, place your arm with your palm facing upward. Trace a line from your thumb to your wrist. Here, you can find the pulse. Using your other hand, place 3 fingers on the wrist. Do not use your thumb because it's not as sensitive as your fingertips. You should feel a slight movement underneath your fingertips, and this movement is the pulse. Did you find your pulse? If not, ask the nurse educator to help you find your pulse. The average normal range of pulse is between 60 and 100 beats per minute. When you check the pulse of your family member while resting and the number is either less than 60 or more than 100, then you call the nurse immediately and do not panic.
Kriti, shall we go for a walk?
Wait a minute. Let me take your pulse.
But you checked in the morning.
Yes, I have to check your pulse thrice each day, and also before and after exercise. Now lie down.
What's the normal pulse rate?
Between 60 and 100 usually. Closer to 60 while resting, and might increase up to 100 after exercise. It's now 70, which is normal.
What if it's outside the normal range?
We must inform the nurse immediately.
Shall we walk now?
Sure, after I make an entry.
What is the average normal range of pulse? Between 60 and 100 beats per minute. What should you do if you check the pulse and it's outside the normal range? Call the nurse immediately, but do not panic. What should you do if you're at home and the pulse is outside the normal range? Again, call a nurse immediately, but do not panic. How often and at what times should you measure the pulse? You should measure the pulse thrice a day, in the morning, afternoon, and once in the evening. You should have now learned how to find and check the pulse. If you have further questions, please ask another care companion or a nurse educator.